Tomorrow, President Obama will try to sell his health care reform ideas to America's doctors. He's proposed an additional $313 billion in cuts to Medicare, Medicaid, and other programs to pay for reforms that could cost more than $1 trillion over the next decade. Joining us now is Republican Congresswoman Marsha Blackburn of Tennessee. Congresswoman, thank you for your time today. Your initial reaction to this package that has been brought to the Hill?
This is too expensive and we can't afford it. And we in Tennessee have had a great example of that in the program Tenn that was the public option that was in competition with private health insurance in our state. And it eventually was eating up every dollar that was in place, every new dollar of revenue that came into our state. This was the experiment for Hillary Clinton health care, and what Tennesseans have learned and what our governor recently said in an AP interview was that it was a disaster. It is too expensive. We can't afford it.
Well, Congresswoman, of course, the supporters of this plan say that we're in such a state that we have to do something. A number of the supporters are saying we have to have a government-run or government-owned insurance plan, while others say that would absolutely kill private industry. Where do we find a solution in there somewhere?
What we have to do is realize that there are some things that need to be reformed. What we have to agree on is that we need to be certain that the doctor-patient relationship stays in place and that patients, this is patient-centered, and patients have the ability to make the decisions that affect them. And that is what we are pushing forward on, a government takeover of health care with government-run, government-financed, government-delivered health care is what the President and Speaker Pelosi and the Democrats are pushing on Capitol Hill. And Shannon, that is something that we just cannot afford to do. What we want to do is make certain that the patient stays at the center of medical care and health care decisions, and that they have the opportunity with their physician to make those decisions. You know, care delayed is care denied. And if you have a comparative results board in Washington, bureaucrats that are going to be tasked with deciding who gets care and who does not, then what you're doing is rationing. So what we have to make certain we do is put the patient first in this, put an individual's health care as the first point of consideration, and make certain that we focus on delivering that care to them.
And how do we preserve that particular set of rights, which most people would agree is the most important thing, while also bringing some kind of healing to a system that seems to have major problems?
Well, you're exactly right, and bringing healing is where we should focus, because we want to preserve an individual's right to determine their health care for them and their family. I have two grandsons, one that's a year old and one that was born this week. And what I want to do is make sure that Jack and Chase have the ability with their parents to decide how they move through the health care process, how they access medical care, making certain that it is affordable and making certain that it is not delayed, that it is not denied, and it is not rationed to them. What we need to do is focus on consumer-driven initiatives and make certain that individuals own their health care records, that we implement health information technologies, making certain that we get rid of the cost shifting that is taking place right now that is so hurtful to our health care providers and our hospitals. And cost shifting is the practice when they are underpaid by Medicare and Medicaid, not reimbursed enough to cover the cost of care delivered, then they shift that over to the individual who has private health insurance, and their rates go up.
Congresswoman, thank you very much. We have to wrap up. Congratulations on your newest addition to the family, Congresswoman Marsha Blackburn.
Thank you.